With more kids going back to school and the Delta variant on the rise, Maine's public health and education leaders have identified a bit of a gray area: childcare facilities. According to the latest data from the Maine CDC, 12 kids between the ages of 0 and 4 are in the hospital with COVID-19. The big question: how do we protect kids who are too young to get vaccinated? Some are too young to wear a mask, and all of them are too young to get the COVID-19 shot themselves. We spoke to a doctor and a child care expert about what parents should do to keep their kids safe.
I continue to strongly urge all Maine people to get vaccinated because doing so may save your life.
The message from Maine's public health leaders is clear.
Or the life of a child who's not yet eligible for vaccine.
It's that last part that child care workers are grappling with.
I think that just puts that kind of question out there. Are we going to see any follow-up?
Tara Williams is the executive director of the Maine Association for the Education of Young Children. It's a nonprofit that focuses on supporting kids and families from birth to third grade and the teachers that work and care for them.
There is no one way that a child care program is handling this situation.
She says some locations require teachers and staff to get the COVID-19 vaccine. Others are not. Since child cares are small businesses, each one can make its own rules about vaccinations, including if the student's family must show proof of immunization.
Those parents being unvaccinated are really providing a link to the disease, to that whole childcare.
Dr. Dora Mills, Maine Health's Chief Improvement Officer, says 15% of Maine's population is under the age of 12 and cannot get vaccinated. The U.S. CDC says it's best for staff and children over the age of 2 to wear masks indoors. And distancing? It's not always possible with such young kids.
You can't tell kids to, cover your cough because they're 18 months old. There's a lot of layers that you can apply in schools that you can't apply to daycares.
Williams says Maine's Office of Child and Family Services previously issued guidance for child care programs, but has not sent any new recommendations on how to address vaccinations for either staff or the families enrolling their kids who are too young to get the shot. She says that inconsistency can cause confusion for families and owners too.
At times when it didn't seem to be coming or it was delayed, it left directors and owners in times of confusion and uncertainty, trying to make decisions that are really heavy and weighted when it's the health of the children in their care.
Maine DHHS sent us a copy of that latest guidance for childcare facilities, dated June 30th. It does not mention any requirements for vaccines, simply that programs should encourage them. So here's the big takeaway for parents. Williams says you should share your concerns with the child care director. Ask if staff or families are required to show proof of vaccination. Ask about masking and distancing and policies about time spent outside. Since each child care can make its own rules, it's on parents to make sure they're sending their kids to a place they feel is handling COVID-19 in a safe way.